pre-op nurse took my hand and she said, I know that this is really nerve-wracking for you, but we do this every single day and we take care of everyone like we would our family. My name is Jane Ehlers. I'm a registered nurse here at St. Barnabas Medical Center, and I'm an altruistic kidney donor. A few years ago, I was in nursing school at Rutgers University, and someone from the Sharing Network came to speak with us. They were talking about organ donation, deceased donor organ donation, living organ donation, and then she said, just throwing it out there, there's this many people on the waiting list, not pressuring anyone, but you can be a living organ donor. And I was like, wow, that's so cool. It sounds crazy, but that would be the coolest thing in the world to be able to share that with someone.
It was a little bit of a surprise because she had already had a number of conversations with the kidney donation program here at St. Barnabas, and then said, hey, I think this is something I want to do.
I was cleared to donate. There was a lot of evaluation, a lot of different tests. And then the week after I graduated college, I donated my kidney here at St. Barnabas. When you're an altruistic donor, they ask you if you have any preferences. Some people want their kidney to go to a baby or a child. So I told them, give my kidney to whoever you think is fit and try to help as many people as possible. And they said that the best way to do that would be to start a chain.
A kidney pair donation chain basically is when an altruistic donor comes forward and starts a chain reaction of kidney transplants. In Jane's example, she donated to a daughter who was incompatible with her mother. The mother then went on and donated to a brother who was incompatible with his sister. The sister then donated to somebody from our waiting list, and this completed Jane's chain.
Not too long after Jane did her donation, we learned that a very dear family friend who had polycystic kidney disease had taken a big turn.
That's when I said to my mom, have you ever thought about it? And she's like, yeah, I actually called them yesterday. I've been looking to get tested.
When my friend and I became an actual match, and I could be a direct kidney donor to her, we were both surprised and completely delighted.
She was cleared to donate. They were a perfect match. And she donated her kidney, I think November 3rd of last year. She felt really comfortable with St. Barnabas because of my experience and the people she had met here and what they had meant to me. So after I donated my kidney, I took my nursing boards and I started looking for a job. I was looking in DC and Baltimore and all these different areas. I wanted to move and grow up and get out of the house. But something kept bringing me back to that nurse in the operating room that said to me, we take care of patients like we would our own family. And I wanted to work somewhere that not only felt like family, but also I would trust with my life and my family's life. And so something just kept in my head bringing me back to St. Barnabas. So I came here. I work on 57-5300, which is a renal pancreas transplant unit. The nurses that took care of me in the hospital are now my colleagues, and I work with them every single day, and that is so special to me. We take care of patients who have donated their kidneys and received kidneys from deceased donors, living donors. I think that being a living donor has tremendously impacted the care I'm able to give my patients, especially the living donors. The benefits of donation for the people that receive the kidneys is so powerful, and I've been able to witness that at my job every day and see what an impact getting a kidney has on people's lives, and I think that's the most special part of my job.